Hey guys, it's Cass again from Dermetel, and today we are going over the connection between HPV and skin cancer. The human papillomavirus is the most common sexually transmitted infection. So common, in fact, that most sexually active men and women will at some point contract HPV during their life. About 79 million Americans are currently infected with HPV, and about 14 million people become newly infected each year. And many times, symptoms won't show for many years after you are infected. There is no treatment for the virus itself. However, there are many treatments for the health conditions or cancers that develop after getting diagnosed. A diagnosis of HPV not only increases your risk of many different cancers, like cervical cancer, but new studies are also showing that having HPV can increase your risk for non-melanoma skin cancers, like basal cell and squamous cell carcinoma. HPV can affect skin cells and make it 30% more likely to develop squamous cell carcinoma than those without the STI. And it is found that the longer you have had HPV, the higher chance is of a skin cancer diagnosis. You can become infected with HPV when the virus enters your body through a cut, abrasion, or small tear in the outer layer of your skin. The virus is transferred primarily by skin-to-skin contact and through sexual intercourse. Because there are over 100 different strains of HPV, many of which will not cause any problems. Some strains affect different areas of the body, and some strains do make their home in the skin cells, which is why your risk can increase for skin cancer. And many times with cutaneous HPV, the treatment options involve medications that usually have a mild immunity suppressant, which can cause cancers to grow and thrive in the body. UV radiation also suppresses the immune system in some individuals, which allows HPV viruses to advance and make it easy for skin cells to become cancerous. For both HPV and squamous cell carcinoma, it is important to know the warning signs and to take precaution to prevent both diagnoses. The CDC recommends getting an HPV vaccine and, if you are a woman, have regular cervical cancer screenings. As stated, many times symptoms do not appear for years and may only be diagnosed after a more serious condition is found first. That's all for this week, guys. Thanks for watching and stay sun safe.